What made us detect this opportunity was COVID and the pandemic we are facing. Since we already knew that Mexico didn't have a very good healthcare system because it lacks quality and coverage, we intended to cover the zones that the healthcare system in Mexico doesn't cover. So we saw how the health train was actually helping people who don't have access to hospitals or to medical treatments. But the problem we saw in the health train was that it actually doesn't cover a lot of zones. It doesn't cover the south of Mexico, and we intend to make the routes in the health train also go to the south and help, especially the area in the south which is in most need of health of the health train, and also cover with our prototypes. The reason why we think our prototype is different from the market is because it actually is non-existent. There is no market about bringing good healthcare to people in rural zones, apart from the health train. But unfortunately, the health train only covers those states who have good railroad systems. And why we think it's frugal is because it actually has no cost of transportation for users. We bring the service to them, and the costs of viability are actually very low. And here our prototype shows two models. The first one is a sort of mobile clinics with an all-terrain van adapted to uh, paramedical equipment and basic consultations. And the second one is also an all-terrain, but this actually is for carrying people back to the train if they wish or need to go there for a more specialized care. We think our solution is viable up to where the roads lead us. We know that there are some rural zones that don't actually have roads, but we can find a way to bring the all terrains to their zones actually. And the only risk we truly see is security because it can be very easily hijacked. But we can work on security and how it can be managed to not get stolen. And well, basically, what I learned from this week is how, with very little costs, we can actually change a lot of people's lives, a lot of people's problems, and how we can be better innovators for the world and for the future.